it's important for our patients to know we're not going to judge you. We're not going to make you feel bad about yourself. Again, honesty. I might be honest with you, like I was with that patient. Some changes need to be made, but everything that we're going to do and say is hopefully done in a respectful and compassionate manner that will help you to know that we want your mouth to be healthy just like you do.
Welcome to the Comfort Dental Podcast. Get a peek behind the mask with real people and real conversations.
Okay, so I could not be more excited today that I get to be with Dr. Alex Kaiser of Comfort Dental in Colorado. And this whole podcast is all about the man or woman, the hero behind the mask. And today, that's you, Dr. Kaiser. So welcome to the podcast.
Thanks for having me. Great to be here.
Okay, so right off the bat, I know I say this to everybody, but I think you have to be a little crazy to want to be a dentist. What was your story? Why dentistry?
Get that question from my patients frequently. Why do I want to spend all my time in somebody's mouth? Why do I want to see the things that I see and do the things I do? And it started with my family dentist, I guess. We had a great family dentist who took care of my family, and so I had a great experience there with him. And then when I was about in 7th grade, I had to have ortho done, had braces put on. And so I had some teeth extracted and went to go do ortho, and they had me in and out of that office for about 5 years, which now I hear patients that get treatment done in like a year or two. And so 5 years was a long time to go in and out of this office and just be exposed to how they do their jobs and what kind of people they were and some things like that. And so that's how I got drawn in. And then after I graduated high school, I didn't really know what I wanted to do. And so that was one of the things that I researched. I did a project in my undergrad and looked into it more completely. And I'd say from there, I was like 80% sure that's what I wanted to do.
Okay, so many questions. First off,
Yeah.
5 years. Did you know at that time that, like, was that just normal to you because you didn't know any better?
I guess. Yeah. That was my normal, I guess is what they say nowadays. I had no idea that other people were getting their treatment done sooner, I guess. I don't remember thinking this is taking too long and complaining about it. I'm a very trusting person. And so, I just, put my life in the hands of my orthodontist, and he did the work. And, to this day, I do get compliments on my smile. So, it's one of those things that, again, drew me is I had a change in my life because of dentistry, and I wanted to pass that along.
You know, as you said that you get compliments on your smile, it made me think maybe in that sense, it's easier to be a dentist because when you're a MD, people are like, well, you can't be overweight. You know about health. But maybe for a dentist, all you have to do is have a nice smile.
Maybe. It's funny that you say that too, because I'll have patients that I'm talking to, or talking about brushing and flossing. And if you know me personally, you know that I'm a very honest person. My wife always says that I'm the most honest person that she's ever met. If there's something that she's cooking that I don't like, I'm gonna express that. But I'll tell my patients, I'm like, look, I used to be the best flosser in the world. I would do it every single day, and ever since I got busy with dental school and getting out and family time so busy, it's like I'm a regular guy. Sometimes I do forget to floss as well, or I just completely ignore it because it's the end of the day and I'm tired. And so, shoot, I forgot where I was going with that.
No, well, you're just saying you're honest about just kind of just, letting people know,
Yeah.
hey, you might have a great smile, but you don't floss perfectly. I mean, you're
Right.
human.
Yeah. Yeah. So, yeah, I think that's one of my things as a person, as a dentist, is I'm just honest, and I try to be as real as I can, with people. Uh, yeah.
So I'm curious, you mentioned at this point, you're 80% sure that dentistry is the right thing for you. When were you 100% sure? Is that in dental school or is that after you graduated?
Uh, so that was, so I graduated, and then, I did some missionary work, for 2 years. And so after that, I had um, I had some classes that I completed for college before I did that. And so I hadn't really taken a step in the direction of what I wanted to do. And so when I got home, I remember after those 2 years, I got home. I remember this very distinctly. I was driving the car with my parents, and we were talking about something, and I think my future came up, and I said, I think that I want to look into going into being a dentist. And they were on board with it. I think they were just happy that I'd finally picked something, because, like I said, after high school, there was really this big indecision on my part. Didn't really know what I wanted to do, and so I think there was some relief there. And so after that, I kind of put the wheels in motion. Found out from a counselor at school kind of what I needed to do to get the ball rolling and go into this, and I did that. And yeah, the rest is history, I guess. From there, finished my undergrad, and took some time for myself. Met my wife out in Utah, and applied for school. And then I I guess you could say my path to dental school wasn't typical. I got waitlisted at a couple of schools, and that didn't really work out. And I was considering retaking the dental admissions test and reapplying. And then I got a letter from the school that I eventually wound up at, which is down in Bradenton, Florida. It's called LECOM. They sent me a letter that said, "Hey, we like what we see. Things could be a little bit better. We're inviting you to come and take our master's program. And if you come and you do well in this program, you're guaranteed shot. You'll be invited to participate in our dental program." And so that's what I did. I took it very seriously, did well, and got into dental school. And so extremely grateful for them, by the way, because they're the only ones that gave me a shot. Without that, I don't know. Maybe been able to retake the test and do better and get into another school, but they gave me my shot, and I took that, and now I'm a dentist because of it.
So I have these kind of like general ideas of like, I like to think of dentists are either more on the like science side or more on the art side. And the science would be, I don't know, like again, loving the body, the science of, what's happening in the mouth versus like the artist that is more of the actual craft person that likes actually doing the mechanical. And it could be a completely failed attempt at having some sort of a binary, but like, which one do you feel like you more are? Are you more like the scientist, dentist, or more like the artist?
I would say more like the artist. Uh, my my family is full of artists. I took 4 years of art in high school. My grandfather, who's passed away a few years ago, he had a huge collection of art, and he was an amazing watercolor painter. And I've sort of gotten into that. That's one of my hobbies now that I've gotten a little bit older. I just finished a painting here a few months ago. I'm a huge fan of Bob Ross, and he's always, we have a Samsung TV, and they always plays these channels when you turn on the TV before you go into one of the apps to watch a show. And so he's always playing in the background when you turn on the TV. And sometimes I'll sit there and watch a painting, but I like to follow along with his paintings. And I did that. and finished one not too long ago. But back to the question, yeah, I would say definitely the art side of it. I remember when I was shadowing, one of the dentists I was shadowing, he took a tooth and it was in the front of this patient's mouth, and there was nothing there. There was nothing left of this tooth. And he took it and he shaped it. And I was astounded. This tooth, you could not tell difference between this tooth that he had fixed and the other teeth in the mouth. And that I think was another, and this was early on before I applied to dental school, but this is like, okay, I have the history in my family. I'm an artist. I love to do this kind of stuff. And I think I'm capable of doing it. And I thought that was amazing to be able to do that and to use that skill to help other people is one of my draws to being a dentist.
Oh, that's amazing. That's so cool that you actually really aren't just an artist in the sense that you are can craft, I guess, with your hands. Because some dentists I know are like woodworkers,
Mm-hmm.
or they're just very tactile, but that it's actually painting.
Mm-hmm.
Do you have any of the watercolored paintings that you've done? Like, are any of them up in your office?
I don't. We have one of my partners. He runs and goes in the mountains and runs, and he takes photographs. And so that's what's up in our office currently is a lot of those photographs, and we get tons of comments from patients on those. And so it might be a goal of mine one day to maybe get one of my paintings in there. I'm very, I guess the word would be self-conscious about my work.
Modest. You're modest.
There we go. Modest is the word. So I'm very modest about my work. And like I said, I'm just kind of starting off. Painting wasn't one of the mediums that I liked working in when I took all those classes in high school all those years ago. I like to draw with just plain pencil and charcoal and things like that. And I always admired painters. I'd never thought that I could do it. And then, yeah, so just got recently into it. But yeah, maybe someday something will be up in the office that I've done. That would be kind of cool.
So Dr. Kaiser, like at some point, you have kind of an idea of what dentistry is going to be like. And then potential meets reality, and you are in a practice, you're a month in. Like, what was the gap between like, oh, I thought dentistry was going to be like this, and it was more like this, for better or worse? Was there any gap between what you thought it was going to be like and what it actually was? Like, were you ready for like the crazy patients? And crazy, I mean that in the nicest way.
Oh yeah. Yeah, of course. Yeah, that's an interesting question. I don't know that I've ever thought about it. Was there a gap? I I want to say that dental school, I think, prepared me really well. LECOM does an amazing job at preparing their students. I think I don't know if there was too many surprises or like there's a ton of like imposter syndrome where you're doing a surgery or something and you're like, I can't believe that they're letting me do this, even though you've gone through the school and you've gone through the training, you know the procedure steps and everything, but it's still like you're performing this thing and there's that idea of like, well, I was working retail in my undergrad and now I'm doing this. And so that I think is more of what I went through. But I think the expectations were there that it was going to be challenging. There was going to be a learning curve. There was going to be this idea of I'm going to be a boss now. I'd never been a boss before. And that's kind of one of the things that drew me to Comfort Dental was this idea that I could own a practice and have a say in in what was happening around the office. Um, and so there's some things that it was just getting used to, and not being overwhelmed by it, making sure that I was learning everything that I could along the way, and not taking things too seriously, but just baby steps, taking it one step at a time, and doing my best to gain experience, and being sure that I was doing everything the right way, I guess.
Yeah, I think it's a difficult tension to balance as a healthcare provider when you have an idea of what excellence is because of what you've been taught, but you know you can't hit it out of the gate. But the only way you're going to get there is through reps.
Yeah,
And it's just that's the reality, you
yeah,
know?
yeah,
Maybe there's some rare unicorns that are just absolutely gifted, almost like the Michelangelos of dentistry that somehow are
yeah.
placing the perfect crown in their first attempt. But the reality is you got to be in the trenches, and that's where you learn, and you have to give yourself grace.
Exactly, exactly. And I, again, very honest person. I tell my patients all the time, like, I'm not perfect. I've made mistakes with patients. Um, but like part of me, again, being honest and ethical, I always am upfront. If 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 something happens during a procedure that didn't go the way I expected, and I need to communicate that with the patient, then I do that. Uh, and it's just about um, uh, it's just about being honest and recognizing that this is a dental practice, and you need to practice every day in order to get better, and those mistakes are going to happen. And I remember the patients that I made mistakes with, and it helps me to grow and be better as a practitioner, and hopefully that those things don't happen too much.
Okay, so I imagine you have to drive home. So as you're driving home, what is it about the day that will come back in your head and lead you to that feeling of like, man, I just love dentistry. Like, what are you thinking about? Are you thinking about a patient? Are you thinking about how smooth the day went? Are you thinking about how well you did on a procedure? Or could it be all of that?
It probably depends on the day. I know there's a lot of times that my favorite part of the day is going home to my wife and telling her how amazing a procedure went. Or uh, one of my favorite things, when I was in dental school, I really loved dentures, and I loved working with patients who needed dentures. And some of the best experiences that I've had as a dentist are when we have patients come in and they've just got tons of issues and tons of things that they're concerned about. And we're able to work with them from the beginning all the way to we're putting their dentures in. And a lot of times that is a game changer for people. And I've had people in tears in the dental chair, because it's such a change for them. Um, and so it's stuff like that I think about. And again, there's days where you do everything right and maybe things don't go perfectly. And you try not to dwell on that stuff. You try to push it back. Uh, I see probably, well, it depends on if I work a 6-hour shift or a 12-hour shift, how many patients I see in a day, but it's probably anywhere from um, 25 to 40 or something like that. And, maybe one appointment didn't go well, but the other ones did. And so it's about focusing on the good, and not beating yourself up when things don't go perfectly.
Okay, so two things here. First, have you heard Dr. Heath Colledge's famous story about dentures?
I don't know. I don't think so.
Okay, so for all of our listeners, you will have to check out that podcast because it was very interesting. Oh, I was almost gonna say it, but I'm like, okay, I'll just say it. Um, he had a patient came in, and somehow in 20 years or some crazy number, he'd never taken his denture out.
Oh,
So it like fused or like was like bonded. And
yeah.
he was just mentioning like, A, like how do you not do that? But B, he was saying the smell was probably one of the craziest things he's ever experienced. And that's why I literally just talked to him. He's like, I can't stand dentures. And here you are. I love dentures. And that's what I love about dentistry is that there's freedom for you as a dentist to kind of be able to bring your preferences in, especially with a model like Comfort Dental, where it's like, you want to do more dentures? Like, okay, so you also alluded, Dr. Kaiser, that you kind of had to learn. There's the good moments, and you've learned to kind of hold on to those. But I imagine as a care provider, it's that tension of like, I want to be, I don't want to say emotionally available to care for my patients, but not be so emotionally available that I can get hurt if they misunderstand my dentistry or if they don't appreciate it or they don't value it. You said you've been doing this now since 2023. Have you had some challenges in that time period of not carrying the weight of a patient that just doesn't appreciate your dentistry?
Yeah, no, uh, that's a good question. So I, I would probably say that, and I did watch some clips from some of the previous podcasts, and there was one that mentioned like patients coming in and saying that they don't like the dentist, and that's probably that is there's so many that come in and say that, and I always say, well, I don't take that personally. Uh, I understand why you don't like coming to the dentist. Like we have to we have to put people into pain sometimes to get them better. Uh, and so nobody wants to go through that. But obviously they want to get better, but they don't want to go through, the parts that are painful in order to do that. And so I would say I feel like I've done well at putting my personal and professional sides apart. Um, and so when people come in and they say they don't like the dentist, it doesn't affect me too much. I try to keep it light. I try to joke with them and say that it doesn't affect me personally. Um, and the yeah, it's you just try not to. You try to remember that um, not everybody's gonna like you personally. Not everybody's gonna like the things that you have to say, and sometimes you have to have difficult conversations with people, and some people take that well, and some people don't. And again, it's separating a little bit, being a dentist and being a person, and just not taking uh, that personally, and remembering that everybody's different, and they're gonna, if they see you, well, great. If not, then you do the best you can to respect that and move forward.
So you went straight from dental school to all of a sudden deciding to buy a Comfort Dental franchise?
Yeah. Yeah. So,
Wow. Like, that just seems like a really big leap. I mean, I think that's amazing. Like, walk me through what were you thinking about in that commitment?
so when I was in dental school, we had, all the different companies come and give their pitches, Aspen and Heartland and Comfort. And, I don't know, something about that visit. Uh, Matt Carlson was there. Something about that visit just stuck with me. I remember going home to my wife and saying after that meeting that, I think I really like this model that they have. I'd like to own a practice. I'd like to, again, have a say, in what happens at my practice. and this just seemed like the easiest path to take in order to make that happen. And so, um, I don't really, I mean, I didn't really explore any other options, any other dental offices. There was a moment where we were maybe looking at going to Texas instead of Colorado, but ultimately, and it was Matt Carlson, who recommended, and we're in Montrose, Colorado. He recommended this office. He knew both of the doctors, and he thought that this would be a great place for our family. And so we uh, we got in contact with Dr. Mangrum and Dr. Olson here, and arranged a time to come visit. We came and saw everything. We liked the town. We liked the practice, and yeah, there wasn't really much else to do but come and get to work.
So I would love to circle back on the community, but before that,
Yeah.
so from what I understand about Comfort Dental, it's that probably as you had some options after graduation, maybe from some of the other businesses and everything like that, that maybe some of them had guarantees, but not as much upside, not as much autonomy, not as much of an actual ownership model. And yet, almost like implied in that autonomy and ownership model is that sense of you having to actually be willing to bet on yourself. Did you ever view it that way of like, okay, like, let's go, Alex, like you can do this?
Um, yeah, yeah. I think there was a lot of confidence there in Comfort Dental and the ability to succeed here. And I again, yeah, there wasn't a whole lot of consideration made. It just felt right, kind of right from the get go. There wasn't too much doubt. Um, the uh, the other doctors and I were all members of the Church of Jesus Christ of Latter-day Saints, and so there's also a culture thing here at this office too, that I was drawn to with the other doctors, and so it just fit so well that there wasn't much consideration made for any other option. It seemed like, yes, this is the path forward.
Okay, so that kind of brings me to my next point, or question, I should say, and that is you'd mentioned going on the mission
Mhm.
uh, after high school, and yet from some of my interviews with other Comfort Dental docs, depending on the community they serve, some of it feels like they're getting to do almost like mission work in dentistry. And then because of the model, even the way that the fees are structured sometimes where I forget who it was saying that like they almost can give away X amount either a day or each week because it's so profitable that for those that aren't fortunate enough maybe to be able to afford it and don't have insurance, that it almost does feel like they're just doing missionary work like in their own community. Is that a sense that you've kind of experienced something similar to that?
I would say, yeah, there's some of that feeling there. We see a lot of Medicaid patients at our office. We see a lot of people that don't have insurance. And so Comfort Dental has provided some tools to help, especially the people without insurance with the gold plan, that discounts uh, basically all the treatment for people. And so, yeah, I would definitely agree. And I'm a very big-hearted person too. And oftentimes I find myself saying to my front staff, we're not going to charge them for that. And sometimes they give me the look like, are you sure about that? And yeah, so I love the opportunity to to help people and to provide a service that's going to help them feel better about themselves, or to help them to be healthier or anything like that. And yeah, just again, Comfort Dental has provided an excellent foundation to be able to reach out and to help people who are struggling to find a way forward and maybe are looking for answers and maybe they don't have insurance or something like that. And to be there and provide that service for them is something I love doing.
And you should be proud of that. There's a lot of dentists that I know that don't necessarily always have the margin to be able to, and some still do in some capacity. But oftentimes, if anything, they feel more of the pressure to like, I don't know, like the treatment options. They're wondering, I don't even know how to put this into words, but the feeling that the Comfort Dental docs I talk to get, where it's like, we have so many patients coming in, and it's so profitable that if anything, like we're not needing to add anything to treatment plans,
Hmm.
And I think there's that freedom there that kind of allows you to feel aligned to being almost like pure hearted too.
Hmm.
Not just a large heart that wants to give and be generous, but also knowing the purity in it, which I think allows you to just feel proud of like what it is that you do, and you should. And I think the greatest tragedy is when dentists don't don't get to feel proud because either their practice isn't doing well, or they're not able to make payroll, or they're not able to make ends meet, and then all of a sudden they start feeling that experience of burnout.
Yeah,
And ultimately, it's like the patients are the ones that suffer the most.
absolutely. Yeah. Yeah, I agree. Uh, and yeah, I feel and like we see a lot of patients here at our office, and so like there's a lot to be done, and I feel like we're finding success here in Montrose and helping people, and also again, I mean, this is my career, and so my ultimate goal is to help people, but also to provide for my family as well. And I think there's a great balance. I mean, obviously I've only been doing this for 3 years, but I find that there's an excellent balance. Like, yes, I can advance my career and provide for my family, but it also allows for again that that work to be done for people at an affordable cost, so that they can also have a life as well where they can provide for their family. People come and see us; they're missing work or whatever, and we're able to provide a service for them that allows them to get healthy and get back out there and provide for their families.
One of my good friends who's a dentist, I think went to like 7 different practices in her first 3 years.
Hmm.
I was just looking for a fit. And one of them, I think she ended up getting fired from because ethically she wouldn't place something, because of some standards that she had. But for you to find a place where not only is there that business model fit, but it sounds like there's that culture fit.
Hmm.
Just tell me a little bit more about just the culture of your practice and what a patient would experience when they come into your practice.
Yeah, absolutely. And to talk on the point of doctors being at other offices before they came to Comfort Dental, both of my partners had other practices that they were a part of before they found Comfort Dental, and they talk about that all the time. And they've even said like, don't don't go anywhere, like stay here. This is where you want to be in order to advance your career. But uh, moving on to the question of what can patients expect when they come in, um, the thing that I do personally, and again, very honest and upfront with people. And just the other day, actually, I had a patient come in, and she was an existing patient. She was coming in for an exam, and she had a treatment plan already established. And so we went in and we were looking at everything, and she just had plaque and buildup on every single one of her teeth. And she's a younger patient. And so we got done cleaning everything, and took my mask down and I went right beside her and I said, probably not going to like what I'm going to say right now, but if there are changes made in your life right now, if you don't start taking care of yourself a little better, you're probably going to start losing some of these teeth. And you're so young. I don't want to see you lose some of your teeth or all of your teeth. Um, and she goes, I know that I need to do this. And I know I need to get started. This is why I'm not doing this. And so we addressed that and went through and found out, she had so much inflammation in her mouth that it just hurt to brush. And so that just compounded where she just couldn't take care of it. And so I've tried to find a balance where I'm very honest with people and telling them what they need to do, but not in a mean way, but in a way that we can help some people maybe have a realization that changes can be made, and we're going to help you make those changes. And if we do this, there's maybe a better outcome for you down the road. And I think as a whole, that's sort of my side of it is being ethical, being honest, being real with people. As a whole, as a practice, I think we all have that sort of mentality that we want to take care of our patients and we want people to leave here feeling good about themselves and being able to tell other people that they can come here and trust that we're going to have their best interests in mind.
You literally just said it right there at the end, and that they would trust that you have their best interests in mind. The ability to broker trust with another human, especially if it's a patient's first time visit, is something that is, it's not common, and it's a very high leverage skill. So for you to be able to do that, it just seems like you have a very high level also of emotional intelligence and the ability to communicate with tact, which is not the easiest thing. So even all of those make you kind of being a dentist just this sweet spot where, again, you're the artist, but you also really, really care. Like, it's clear. No one questions whether or not you care, but then you also have that ability to communicate it in a way that they can receive it. I can see why dentistry is such a rewarding profession for you and why you would get so much out of it, because there is that alignment with, like, this is your brilliance and this is a profession where you're not just siloed in front of a computer screen writing code all day. You're actually getting to be the hands that take someone out of pain right now. And you get to see them leave your office and all of a sudden be like, wow, doc, like, thanks so much, you know? Yeah, like this, I don't know. That's just really cool. They say, like, contrast is the mother of clarity. And again, I talk to a lot of dentists, but there's just a very sweet demeanor that you have that I'm guessing your patients do recognize. Did you know that kind of emotional intelligence was really going to serve you in dentistry, getting into it?
I don't know. To tell you the truth, growing up, I was very introverted. I didn't really communicate well. I didn't like talking at all. It was hard to make friends, and it was hard to do public speaking and everything like that. And so it's something that I've had to learn as a skill is to communicate well. And even early on in my career, I remember I had patients who would be dissatisfied, and I remember asking them, like, okay, we have this problem. What ultimately is the problem? And they're like, well, I just don't feel like I was told this, or you know, we were doing something and then you got up and walked out of the room, and I was like, well, what's going on, sort of thing. And so I had to learn early on. It's like, people cannot read your mind. And so you need to be able to communicate everything that's going to happen. And I learned to do that. Uh, at the end of just about every visit, I explain to the patient, okay, what are we going to do next? What's still on your treatment plan? Maybe, I'm going to get up and leave now. I'm going to leave you with one of my assistants. They're going to take care of this, this, and this. Do you have any questions for me? And I feel like people have responded really well to that. I don't feel like I've gotten those same sort of situations where I have people telling me, you know, there wasn't this communication there. Um, and we've seen good results from it. In our Google reviews, we've got people that say, we went in, everyone's very professional. They helped me to understand what my needs are and what we're going to do going forward. And they appreciate that. And so, it's not something inherently that was in me, but was something that needed to be learned and to make mistakes and grow from that.
Well, you are doing it, Dr. Even here, being on a podcast,
Hmm.
you know, it's not like what do they say? Like the number one fear still is like public speaking.
Yes.
Um, but that ability to actually see and understand what is it that a patient is saying behind what they're saying sometimes,
Hmm.
because of their fear or that financial pressure or whatnot. And it is like a lifelong journey. And you're going to be even learning it as you're a husband and as you're a father and just the whole human side. And I feel like if you can love the human side of dentistry and love the clinical side of dentistry, then dentistry is like the perfect profession.
Yeah. One of the things I really remember from dental school is the periodontist that we studied under. He used to say that you want to be a dentist. You don't want to be a technician. You want to be a doctor, if that makes sense. So you don't want to go in and just look at a tooth and okay, I'm gonna fix this tooth. Like there's a person attached to this tooth that has hobbies and a career and family and problems and all these things. And so and I think the point of what he was trying to get at is there's also a human body attached to this tooth, and so you have to treat everything as a system. Um, but yeah, you never want to get in the habit, I guess, of just trying to treat teeth. But you got to remember that there's a person there, and it's important to connect with them, and sometimes let them know that everything's going to be okay, and that they don't have to be scared, even though a lot of them are. And I always tell them, we're going to do the best we can to help this to be as good of an experience as possible for you, and have you walk out and hopefully be feeling better.
So, doctor, what's one thing you wish every patient knew about oral health?
What is one thing? Um, Boy, that's a fantastic question because I could probably think of a lot that I want people to know. Um,
Top three, then. Top three.
well, let's say hmm, let's say I think I'd and I say this to patients sometimes. Patients will come in and they'll have regrets about how they took care of themselves. And a lot of times I'll say, you know, it's it's not important what happened, um, or not that your past isn't important, but you can't change the past. Um, and but you're here now in the chair, and we're gonna do everything we can moving forward to maybe change some habits, or to get you in a place where you're happy again to smile and express yourself, or whatever it is. Um, yeah. And so I guess the point there is, and I don't know if this even answered this. I don't even know if this answered the question, but um, it, sometimes it's not too late to change things, and to change habits, and get things better again. Um, you know, sometimes we have to move forward with a treatment plan where we do take out all the teeth. And so in that case, it might be too late in their mind. But again, denture guy, uh, there's always something that we can do to help you feel at least more normal again. Boy, I did not know if that if that was the answer that you were maybe hoping for on that one.
Oh no, that's great. So final question. If there's a patient out there and I don't know, maybe they haven't come in a while and they're a little nervous because again, they don't floss or who knows what. And they're considering Comfort Dental, but there's more importantly, they're considering your practice. What would you say to them?
First thing that came to mind was, me personally, I know the other doctors as well. Like, there's not going to be any judgment there. Okay. If you haven't been in a while and you're nervous about, oh, well, they're going to look at me, and they're going to put me down, and they're going to chastise me, and tell me I need to do this and this and this. And I've heard all that before, and it's hard to do that. And so I don't really want to hear that. There's not going to be any judgment there of you as a person. We know that people have struggles. We know that, life gets busy. That's another thing I hear a lot, especially like, women who have just been pregnant. They gave birth. A lot of times I'll hear from them, I was pregnant, and that was a hard toll on my mouth. And now I've got a baby. I'm not sleeping, and all of these things. And, there's, we're human too. We have families. We understand that life gets busy. And so I think it's important for our patients to know we're not going to judge you. We're not going to make you feel bad about yourself. Again, honesty. I might be honest with you, like I was with that patient. Some changes need to be made, but everything that we're going to do and say is hopefully done in a respectful and compassionate manner that will help you to know that we want your mouth to be healthy just like you do. And we wanna help you get it there, and that's all it is. And you shouldn't be afraid to come in if there's things wrong. You can trust that we're gonna be on your side, I guess.
Okay. So, Dr. Kaiser, thank you so much. Just seeing again your heart for genuinely the patient. I can see why dentistry is the perfect profession for you. I would trust you with my teeth. Thank you so much for letting me interview you today.
Thank you so much for having me. This was a great experience.
Thank you for listening. You can learn more about Comfort Dental at comfortdental.com.